part 2 of the AAP's updated recommendations on breastfeeding. In part 1, I talk about what the main takeaways were in my opinion. So going through each of them. Duration. This one's going to be the most triggering to most people. We have increased our recommendations to 2 years. So you should introduce complementary feeding at 6 months of age. Nothing's changed there. Essentially what we're trying to do here, really provide that support to mothers who need it or want to breastfeed beyond the first year of life if mutually desired. It's super important. This is not going to be the case for every family, my family included, nor is this meant to say you have to set a high bar and you must attain that 2-year check mark. That's not what we're trying to say. We're instead trying to provide that support to mothers who do need it beyond the first year of life. The other thing is these do bring recommendations more in line with the WHO, the American Academy of Family Physicians, and ACOG, as well as Canadian Pediatric Society. Many pediatricians within my field, and I've duetted a few videos like this, tell mothers they have to stop nursing after 12 months of age, breast milk's no good, that it's mostly water. This is meant to really stop that. If a mom wants to or chooses to, then she should absolutely feel free to do so if mutually desired by her and the baby. It doesn't work for every family, and that's really important to point out here. Recommendations should be individualized, but if a mother should choose to, that is something that we should support as pediatricians and not necessarily say like, nope, you absolutely have to stop because after 12 months, it's just no good. It's never been the case, and this policy is trying to say that. Another thing I like about this policy is they focus a lot on maternal benefits. Of course, we talk about infant benefits for the AAP. Motherhood is a lot of self-sacrifice, and it feels good to say that this is also good for the mother. What I don't like is that they hit on it from a healthcare burden standpoint, and I just feel like that's the last thing a mother is thinking about when she's trying to nurse her child. Oh, maybe this will help prevent me from getting diabetes and then decrease the burden of healthcare. It's not what moms are thinking about. In the minds of parents isn't really helpful. Overall perspective as a healthcare professional, sure, it's helpful to pediatricians. I'm kind of plus minus on that.